Tens of thousands of lives have been lost since the opioid epidemic first hit Canada. Here in BC on the downtown east side is Ground Zero. Joining me today is Trey Helton, manager of the Overdose Prevention Society. Trey, what's happened since the epidemic first began, and has anything gotten any better?
It's continued the same. I mean, the drug toxicity is much more unstable now with benzodope being a regular mainstay now. It's either like it's a 50-50 crapshoot if you get regular fentanyl, which is deadly, or fentanyl mixed with benzodope. And the Canadian Health Authority just released a standing findings on things that could be done better around here, and they released the stats, and they're not really doing anything. Like, there's a lot of things that could be done. It's like they just keep doing investigation after investigation and not doing anything, releasing the findings. So the fact is, like, winter's coming, and a lot of the SROs and low-income resident units in the downtown east side have lit on fire recently, and we need more housing for people. So definitely for the wintertime, yeah.
I mean, Tent City is literally just a block away from us right now. I mean, people are preferring to stay outside rather than stay in these SROs because of, issues with bed bugs and cockroaches and other things. But what else should be done immediately?
More shelters would be great. The shelters are already at max capacity, and it's only going to get colder. More resource centers within the neighborhood for people to take showers and maybe wash their clothes. That would be something that could be helpful, and obviously safe supply options. So,
with benzodope, I understand that you continue to keep overdosing, that even Narcan can't even stop the effects of benzo. What are you doing on the front lines to help people that are going under because of benzo?
Just caring for them, making sure that we monitor them, and if they go back into an overdose, we take care of them properly and ship them off to the hospital as necessary. I mean, it's just about letting people walk their path, and when they're ready to talk about some sort of recovery option, I'm always there for them to share what worked for me and what didn't work for me. And if they ever want to make a detox request, I can make that call for them. Unfortunately, there's a lot of barriers to getting into detox. If you have benzodiazepines in your system, it can be incredibly difficult to get into a detox facility due to the fact that benzo withdrawal is incredibly dangerous, and they need to be monitored by a doctor in case they go into convulsions or a seizure. So even if people don't want to take benzos, but they have benzos in their system, it can complicate detox access. So it's just really sad.
The drug spectrometer, is that still a thing down here? Are they still testing drugs, and have they given you more options to test those drugs for people here on the street?
It's limited. I mean, there is drug testing provided by VCH. It's sporadic. I don't always know the times. They're at Insight at 139 East Hastings on different days at different times. Sometimes the drug testers themselves are overworked and feeling burnout, so they can't come in sometimes. But I always just refer people to get your drugs tested, located at 880 East Hastings. They're open 7 days a week. From 12 p.m. to 9 p.m. So, but the thing that really sucks about it is that everyone goes there. So if you're going there and you're in a rush and you want to use your drugs right away, sometimes there could be a 2-hour wait just to get a small sample tested. So people still end up using alone just to get their fix quickly. So I mean, more drug testing facilities within the downtown east side would be better.
Trey, you've joined us now a couple times on our show, and you've talked about your concerns here on the downtown east side. Has anything improved at all since we last saw you?
I don't think so. No, not really. Nothing. No, that's really sad. I don't really put me on the spot there, Tina. I don't know. Nothing's improved. It's really sad. I don't know how to say that. I laugh when I'm nervous. It's nothing funny. Nothing's improved. Absolutely nothing's improved.
Trey, thank you so much for joining us today, and best of luck with all your work. Thank you. Back to you in studio.